Every pregnant mother is always wanting to know her expected date of delivery. The anxiety of labor pain clubbed with the excitement of the arrival of the little one brings a lot of mixed feelings. But the joy always predominates the anxiety. Hi friends, this is Dr. Rajeshwari Reddy. I am an obstetrician, gynecologist and a laparoscopic surgeon from Hyderabad. In this video, I will be talking about how to calculate your own delivery date. The total pregnancy duration is 40 weeks or 9 months 7 days or 280 days. So first let's understand what is a LMP. LMP is the last menstrual period. It is the first day of the last menstrual period. Why do we calculate from LMP? This is because the egg starts forming on day 1. The ovulation happens in the mid-cycle, and when you actually miss your periods, it's already 4 weeks of pregnancy. Now, if you have been having irregular periods but used an ovulation kit or you did a follicular studies to assure ovulation has happened, then you can just add 266 days to that date of ovulation and then calculate your expected date of delivery. In case of IVF, you can calculate about 261 to 263 days from the day of embryo transfer. So, we calculate 40 weeks from here on, which is to add 7 days to the day and subtract 3 to the months. So now I'll exactly tell you how to calculate. For example, if your last menstrual period is say 4th of March 2022, then your expected date of delivery would be 4 plus 7. That is, you add 7 days to 4 and then you subtract 3 from the month. In which case, your expected date of delivery would be 11 December 22. In women with regular menses, the early pregnancy ultrasound and the dates almost correspond exactly. So, what do you do if you are not sure of your last menstrual period or you had irregular periods? Then you get an ultrasound done for an early pregnancy. Then you can consider that as your exact date with a variation of say 2 to 3 days. The first trimester date is considered as the most accurate one. This is when the first viability scan is done. That would almost be a very appropriate expected date of delivery. Many people also wonder why their date keeps changing on different ultrasound reports. So, ultrasound expected date of delivery is calculated by a software by entering the measurements of the baby as in the head circumference, the abdomen circumference, long bones as in the leg. And this depends on so many factors like the nutrition, the growth of the baby, the baseline health of the mother, the genetics of both the parents, the comorbidity of the mother, etc. So, in the second trimester, there can be a difference of 6 to 8 days, and in the third trimester, about 8 to 10 days difference is also acceptable. In women who had menstrual cycles of say 45 days or 60 days, etc., we can take repeated scans at regular intervals, and if the interval growth is corresponding, then we consider that as their expected date of delivery. Suppose if there is a complication like say a restricted growth due to intrauterine growth retardation, or there is a big baby because of a diabetic mother, then we consider the expected date of delivery calculated by the last menstrual period to do the dating of the baby. Only 4% of women actually deliver on their expected date of delivery. Most women deliver between 37 to 41 weeks. But still, knowing your EDD helps to prepare oneself better for delivery experience. Thank you.